Okay, thank you.
Okay, colleagues, we're going to move to Myanmar, and Sarah Bell from UNDP is connected, and I think, yes, I see you on the screen, sir, Titon Mitra, who's a UNDP Regional Representative in Myanmar, speaking from Mandalay. We're very pleased to have you with us, sir, so I'm going to throw immediately to you for your remarks, and then we'll take questions. Over to you, sir.
Thank you very much, and good morning. Apologies, I literally got out of the car from Sagaing into Mandalay, so I'm a bit rushed here. I just want to go through some of the numbers which I think you're quite aware of, which is that at the moment, the latest death count is now exceeded 3,500 and is likely to rise. There's well over 4,000 people injured, and 80% of buildings are damaged. Probably half of those in the major townships of Sagaing, Mandalay, and Monwa are severely damaged. To put this in perspective, the scale in terms of what has happened to Myanmar is probably the second most deadly and devastating disaster since 1900, following Nagas. Unfortunately, we've moved into a tragic phase where search and rescue operations are pretty well ended, and they've shifted to search and recovery. The major needs remain, as you will in most of the crises in these early phases. The health system is completely overwhelmed. Hospitals are unable to cope with the number of patients they're dealing with. There's an incredible short supply of medicines and medical supplies. Very high risk of waterborne diseases with the urban water pipe systems broken, water storage facilities damaged, and sanitation is now becoming a big issue as people who have been forced out of their homes are resorting to open defecation with very little in the way of latrines for them to use. Shelter is a really big issue, and we've had recent rain, so people who are really fearful to go back into their homes are sleeping on the streets at night. And they're often without any sort of cover. Food is an immediate issue. Markets are severely disrupted, not operational, certainly in Sagaing and Mongwe. And people don't have incomes, and we're seeing pretty ready signs of hyperinflation in place. So the UN system as a whole has now mobilized its teams doing rapid needs analysis, assessments, and we have distributions already commenced. UNDP, for its part, have started distributing non-food items. We're using cash for work to start some of the smaller debris clearance. We're also undertaking rapid building and integrity assessments just to see which buildings can be used. For example, the hospital in Sagaing, all the patients are in the car park in 40-degree heat. And if we consider that the building cannot accommodate them, then we want to move them back as quickly as possible. And we're also working with private entities who are doing debris clearing, and they're doing debris clearing without adequate protective gear, not really much science to it, and with the risk of asbestos inhalation. I just want to make three key points beyond the overall context. One is that this crisis is one that has major impact in urban areas. So we really have to ensure that we avoid creating unnecessary dependencies and limit the relief phase and move to a recovery phase as soon as possible. So linking the peripheries where agriculture production is still taking place to the urban areas, getting the markets operating, getting people in jobs and getting income in their hands is a priority. The second point I want to make is that aid has to be provided impartially. So there is a ceasefire that's been announced by the resistance groups and the military. We're hoping that creates a space to be able to reach everyone in need, irrespective of their affiliations. And the third point I want to make is that we have to recognize that this is a compounding crisis. Before the earthquake hit, nearly 40 million people were living on or below subsistence levels. Nearly 20% of the rice fields were already lost to conflict. and food security was insecurity was created because of hyperinflation impacting on the cost of inputs and the cost of purchase. And the civil disobedience movement had certainly completely disrupted the delivery of social services as people had chosen to leave public service institutions. So the point I really want to make here is the earthquake has really compounded an existing crisis with very deep vulnerabilities. And if we look to situations like Turkey, where the recovery process is still taking place 3 years on, you can just imagine what is required here. And I hope, as my last point, that when the cameras turn away from Myanmar, as they inevitably will and have in the past, that this doesn't return to being a neglected crisis. Thank you.
Thank you very much, and thanks to your efforts, that hopefully won't be the case. We need the spotlight bright on the situation there. So thank you very much for those comments, sir. Do we have questions for Mr. Mitra, either in the room or online? We have a question from Gabriela of Proceso of Mexico. Gabby.
Thank you. Thank you very much, Rolando. Do you hear me?
Yes, we do.
It's okay? Okay. Okay. You know, when there were another earthquakes like in Turkey and, you know, in other places, there's a lot of willing to help from the people. They send a lot of, you know, things. But the problem, for example, in Mexico, is that the aid, it was, I mean, a lot of people help, but the aid wasn't arrived to the place of the earthquake. So I don't know if you have any, if you saw something like this, because sometimes there's a lot of corruption in the countries that supposedly have to help and send all the things that they have to send to the place. Do you have any kind of you know, like protocol or something that you can do to be sure that the things are getting to the place that they should to?
Thank you. Should I answer the question now?
Yes, Mr. Mitra, go ahead.
Okay, thank you. So one point to make, and as you've observed, in many crises, the first responders are actually community groups who, out of the goodness of their heart, trying to gather as much relief items and provide support. So one of the issues is that that is often provided in an uncoordinated way. And in a situation like this, we've got many trucks arriving at one time, so traffic is very hard to manage. Distributions aren't organized, and people are probably getting assistance that they may or may not need. So coordinating both official assistance, that from the UN and international NGOs, and that from charitable organizations is a big issue. The challenge, of course, here is that it is the military authorities that are in control of many of the areas. So we are very dependent on those authorities to coordinate the support. But the concern, of course, is that that coordination has to be done in a way where aid does not become politicized and those in need receive it. And as you know, with an active civil war, we have to make sure that the aid, if it's coordinated by military authorities, is going to areas which may be in resistance control.
Thank you very much, Mr. Mitra. We have a question from Christophe of AFP, Agence France Presse.
Christophe Vogt, Agence France Presse. Thank you for taking my question. It's I want to come back on what you just said about how partisan the question is, how partisan is the military in the distribution? You were asking a question, but maybe you also have the answer. Do you see that aid has been redirected to areas that are more pro-government, or I don't know exactly how to say that? And also there were reports earlier at the beginning, just after the earthquake, that military was kept its military operations going. Is that something that you still see despite the ceasefire?
Yeah. So let me answer in reverse order. So as you know, with the announcement of the ceasefire, in fact, on the day after the earthquake, there was still a number of incidents of aerial bombardment. And even after the announcement of the unilateral ceasefire, there have been military action. So we're not necessarily seeing a complete cessation of hostilities, but certainly a very, very significant slowdown, and we hope that does translate into a cessation of hostilities across the board. The sort of bias in aid, this is something that is not readily apparent at this point, but it's a qualified statement in the sense that, as I've just said, I've come from Sagaing, had no issues. Our distribution teams are working in the urban areas, and so distribution there is not a problem. Distribution in areas controlled by the SAC so far has not been a problem. We are aware of a number of non-government organisations that have been trying to deliver assistance in, let's say, mixed control or resistance controlled areas. But whether that translates into full and free access, I think it's too early to say. What I can say is that, we have to ask and ensure that the response is a positive one, that aid is delivered to those people in need, irrespective of location. And the SAC have an opportunity to demonstrate that they are willing to do so.
Thank you very much, sir. Further questions? No, maybe I'd take this opportunity to echo what the spokesperson in New York mentioned yesterday. He did refer to the special envoy of the Secretary General, Julie Bishop, who is in the region. She was expected to be in Myanmar today. I don't have an update for you at the moment, but certainly should we receive updates, we'll share those with you, the important meetings that she is expected to have, Julie Bishop. Sir, I don't see any further questions for you, so I'd like to thank you very much. I know you're extremely busy, jumping out of cars, doing all sorts of important work. So we really appreciate you making this time for us here in Geneva. And good luck to you in these continuing efforts.
Thank you very much for the opportunity to speak. Thank you. Bye.
Thanks to you.